goal of the third conference is to concentrate on cardiac myxomas. These are more common cardiac tumors that many cardiac surgeons have actually dealt with. But I want to solidify some knowledge gaps in terms of what the knowledge gaps are and what the international experts feel about those knowledge gaps, and we can move forward even on cardiac tumors that are as common as cardiac myxomas. It's one thing to talk about extremely rare cardiac tumors, but another thing to talk about cardiac tumors which more cardiac surgeons actually get involved with. So this is going to help a common cardiac surgeon with the more common tumors that they deal with every day. Cardiac myxomas are dealt with in general and can be dealt with in general by the usual cardiac surgeon. They don't necessarily need an area of expertise, a silo of expertise around the world. So that's why I think that it's important to concentrate on cardiac tumors that many cardiac surgeons can and do deal with on a daily basis. The first two conferences are starting to have some impact around the world. I've been impressed with the number of people that have actually heard of the conferences from a medical point of view, and have also been impressed with the number of emails and requests to review cases by me from around the world. I had referrals from India, China, England, South America. A lot of people from around the world have actually started to learn about cardiac tumor through the conference site. Requests for a treatment of cardiac tumors can be difficult, especially when people can't necessarily afford to come here or may not have the expertise in their own country. It's still very frustrating, and the hope of the cardiac tumor conferences in general is to improve knowledge, not necessarily by patients, although that's very important, but also by the practicing people that are going to treat them in the future. There are no new centers of excellence around the world, but I think as knowledge improves, there's going to be more and more talk of it. I have traveled around the world giving some lectures regarding cardiac tumors and always mentioned it, and there is interest in it. So it's just starting now. I think it's going to take a little while before we actually do get those centers of excellence, but it would be great to have those centers of excellence, so when we get the emails from other parts of the world, we can direct them to a center closer to them. Go to the website. You can learn a lot about the previous talks. The way we've set up the website is that they will have lectures on the website, so that if you want a resource about the types of tumors that have been discussed previously and going forward, you'll have an excellent resource online by international experts in the field. There are people around the world who are interested in cardiac tumors, and go and see your physician and make sure that you don't stop until the physician goes forward and finds an expert in the area, even if it's just a referral to the website, so that they know that there actually is somebody in the world who's interested in this sort of thing.